Yeah, that is a very important question, and I don't know that we have answers. We are looking at that nationally and internationally. There is, you may be aware, there's a new group that has been formed in Canada to look at the question of immunity, and Dr. Mel Krajden, who's one of our scientists from and medical microbiologist from the BC Centre for Disease Control, is one of our members on that very august group. It's being headed by Dr. David Naylor. So these are the questions that we're asking. What I can tell you is from the data that I've seen around the world, particularly from China, but more recently a number of case reports and studies from South Korea, from Europe, it's very likely that we do have some immunity when you have been infected with COVID-19. So that means your body develops antibodies that protect you from getting reinfected. We have had a few case reports where people have tested positive and may have had some milder symptoms after they initially recovered. And there was a cluster of case reports out of South Korea, for example, that looked at that. And I think I mentioned at the time that we didn't know whether it was just that they were shedding virus that was not live virus, because the tests that we have are still challenging. And more recently, that seems to be the case. If we look at other viruses, particularly other coronaviruses, once you've been infected with one, you do tend to have immunity at least for a period of time of weeks or months. It may not be long-lasting immunity, and that's one of the challenges we have with other viruses like influenza, where the virus itself can change quite a bit, and therefore your immunity isn't specific enough the next season, and that's why we need to have an influenza vaccine every year. So we don't know the answers to all of these yet. Part of knowing the answers will be having a very valid test. And as I've mentioned, we're doing a lot of validation of different serology tests that measure people's level of antibodies. The other thing we don't know yet is if you have to have a specific level of antibodies in your blood to have full protection. And some people who maybe had a mild illness, they don't develop enough antibody to have full protection. So these are all the challenging questions that we don't yet have all of the answers to. I believe most of us, looking at what we've seen so far, believe that people who have been infected have immunity for at least a period of time. Whether that's weeks or months or years is yet to be determined.